My title is The Cognitive Hospital. I'm not a data scientist, but I believe that this audience is the future. So I want to inspire you about how we can see and develop hospitals in the future. I work for a company that is over 100 years old. You probably know IBM. And IBM has transformed itself over a couple of times. And through the whole history of transformation, we have seen a lot of changes. We had tabulating computing, we had mainframe computing, we had personal computing, we had mobile computing. Or we didn't actually have mobile computing, but that was the evolution. And if you look at that whole evolution of IT in that over 100 years evolution that we had, then one thing hasn't completely changed. And that is the way how we interact with machines. When you see this picture, you're very familiar with it, that calls emotions. And I've been working in the healthcare field since over 17 years. And if you go to a hospital and you look at what we did as IT companies in hospitals, then we didn't do a really great job in creating an environment that is pleasant to work at, that is really looking at the front-end staff, that is really helping front-end people, like doctors, nurses, to do a better job. No, we added more confusion. And if you look at that picture, we added more confusion to their work. And if you look at nurses today, then they only spend 20% of their time directly at the patient. At the same time, in all the European countries, we're talking about shortages of staff. We're bringing over Eastern European people to Germany because we don't have the skilled staff anymore. So something is wrong if you see that the nurses only work 20%. If you then look at physicians, and I talked to the chief medical officer of Röntgenkliniken, and I said, like, how much time do physicians today spend on their keyboard? It was over 30% of their time that physicians today spend on a computer. That is a waste of time. That is the way how we're dealing with IT and how we interact with machines and how physicians work and nurses. We have to completely change this. And if you look at how EMR, that's the electronic medical records that are being used in hospitals, are designed, and in my past, I was a product manager for one large IT company, or the largest IT company in Germany, and we developed solutions for hospitals. We never talked to the end user. We just looked at functions, and we designed the software around the machine, not around the human. And EMRs, the electronic health records in a hospital, if you talk to physicians, if you talk to nurses, and you tell them that you work in IT, they're probably going to shoot you. Because we didn't do anything really that helps them and to support them. It was helping the management to be able to build in a hospital. So we need to really rethink, and that sounds very familiar for you guys, really rethink how we're going to absorb information, how we're going to process that information, and how we're going to represent that information. And that's why within IBM, you probably heard that we started this era of cognitive computing, where we believe that cognitive computing can change healthcare, really transform healthcare in very different ways. And today I'm going to only focus on the hospital itself. And within cognitive computing, that sounds very familiar because the audience here is very techy, is that we have technology that understands the environment. We can handle unstructured information. We can build hypotheses and abstract concepts out of that information. And we can learn out of the use of these systems. So these systems are self-learning. So these systems are going to completely change the way, and you look at most probably from a data perspective, but if you look at it from an interaction perspective, these systems are going to completely change the way how we interact with humans. And with IBM, we started to work on Jeopardy, natural language. Now we're working on image processing. We are planning to pass the radiology exam in the next 3 years. And we're going to use all kinds of information. We're going to create systems that actually do that what humans do. They're going to see the environment the way how nurses and physicians do that, and they're going to see that better than humans do. And if you look at what cognitive systems are really good at today, or AI, artificial intelligence technology is good at today, is we are better in understanding natural language. We are better in extracting knowledge. We are better in machine learning. We learn better than humans. We don't have, these systems don't have a bias. Bias in healthcare is a really big problem. You go to 3 different doctors, sometimes you get 3 different diagnoses based on bias. And these systems, they have endless capacity. You can digitalize knowledge today, you can scale it. What these systems don't do, and which is an important factor in healthcare, is that they don't have compassion. Healthcare is a lot about compassion. But if you look how much time physicians and nurses spend today on that factor, compassion, then it's very limited. So there is a chance here, if we use the technology, bring that technology to use, that perhaps these human factors in healthcare will get more time. We all complain when we go to a physician, we have 7 minutes, and out of that 7 minutes, you have a real conversation from 30 seconds. But healthcare is not only about clinical data, your genome. 50% of your health is your social life, is your behavior, is your lifestyle, is other things. So by looking into, I'm going to give you a few examples in the technology and talking to hospitals, I've created a vision, what I call the cognitive hospital, which we are now deploying or trying to implement into market. And that cognitive hospital should be a hospital that really is driven and empowered by a central digital cognition, and where nurses and humans interact, and nurses and physicians interact in a very natural way with machines. And then where information as well that is collected is really translated directly in knowledge. Now, that sounds for you all very familiar, because this is actually what you are doing every day. But we want to implement it into the whole hospital. Is the tone?
It's going to go 100% failure within 72 hours.
So, this was a clip, the tone wasn't done at the beginning, but actually, this all sounds familiar, HAL 9000. I'm actually, as an IBM, not allowed to use HAL as an example, because it is a bad AI. But if you look at the interaction, how HAL communicates, there's no keyboard, there is human interaction that is very natural. And actually, that sequence was a sequence where HAL predicts that in 72 hours, a machine is going to go to failure. Well, if you replicate that now to a hospital, and you have a nurse, and she has a cognitive assistant, and you would use information out of different kind of sources, and the nurse would hear, well, that patient is going to go into failure in 72 hours, and by the way, I organized the physician, and I organized that nurse, and you have to go to room 301. That is what, for me, a cognitive hospital is. It is a hospital where humans are guided by a cognitive decision tool that helps them to make better decisions. We have actually now started looking into what we have in that volume. It's the other way around. What we have been doing with IBM over the last years. And I found a project that was in 2008 in Toronto in the sick kids hospital. In the intensive care unit, at that time, you had 14 devices that were measuring different kind of medical information, body temperature, movement, breathing, oxygen levels. And all these devices, they store data for 2 hours and then it's gone. And then nurses chart and they look at these numbers and they have like values, like average values, and they send an alert. So what we did there in 2008 is we stored in Stream Analytics using Hadoop for 2 years in, I think, 2,200 data points a minute. We stored that information over a period of 2 years. And then we looked, what can we detect out of that information? And then we looked in the medical records to certain medical events. And actually what we discovered was an algorithm that predicts sepsis 24 hours earlier than actually every medical book has been explaining. So going back to that, what you saw with HAL 9000, critical failure, 78 hours, we actually did this. We did this in an intensive care unit. And then I asked myself the question, what happens if you scale that kind of principle where you collect all information, not medical only, perhaps process information, perhaps events, and you collect it from the whole organization over a period of 2 years, and you let you guys sit on that data, and you start building knowledge out of the data. I truly believe we can do that. If Elon Musk says that he can develop a driving car in a non-plannable environment where cars are interacting with each other, then I think we can guide the nurse in a closed environment, which is also non-plannable, and we can develop not the self-driving nurse, but the assisted nurse, assisted by cognition, that actually comes out of the different sources of information. So, what is that transformation is going to do? So I've then looked into the different areas where cognition or this technology is going to have an impact. First of all, it's going to have an impact on the way how we interact, and that's actually what we want. We want to bring that nurse back more than 20% of the time to patients. There is a huge business case if you can bring that nurse from 20% spending on the patient to 50 or 60%. There will be investments there because you'd have to look at as well, is somebody going to pay for that solution? So the way how we're going to interact is going away from keyboard, it's going to be audiovisual. We're going away from pooling information, what they actually still do today, to bringing that information in a context awareness. We're going to integrate all devices using IoT technology. And we're going to interconnect all devices that are, and hospitals are asset-rich, all the device and information. Then, in terms of responsiveness, we're not going to only monitor patients when they're in intensive care unit. Wearables now get a level that they are really on a level that you can use them for medical care, and they are cheap. So we're going to monitor patients before they enter the hospital, when they're in the hospital, and when they leave the hospital. So I call it all-care monitoring. Then you're going to go away from reacting. There's an alert, my phone goes, I have to run to 301 to do something. Now there's going to be a voice that tells you, you have to go there because in 24 hours something is going to happen. And then on an organizational level, and this is really exciting, I truly believe if you then have all that information that is based on medical events, based on process information, based on location information, based on literature, and you bring that all together, that you can create a contextual learning organization, machine learning organization, but that at the end, when you have that, that you can replicate that. I think when you create such a hospital that really captures all that knowledge, everything what happens in that hospital over years, that you will replicate that knowledge and you're going to be able to replicate it into countries where knowledge is not available. I've been focusing the last 5 years in Eastern Europe. In Turkey, they're building 72 or 75 new hospitals. They don't have the knowledge to bring that process knowledge in that building. What if we can start copy and pasting a whole organization based on knowledge that we capture? We started doing, and I was then further looking, what have we been doing in single silo projects? So we started working on patient experience tools using cognition, where patients or children are actually able to answer and question, or to question and get answers on their disease. So we all remember that child that 2 years after the introduction of the iPad was trying to enlarge that newspaper, and it's like, why doesn't this move? I truly believe that children that grow up with toys like this Cognitoid, this is a toy from a partner solution of ours that is connected to Watson, and kids can ask questions and answers on that. That children who grow up like that, they're probably going to go back in time, like when we see a keyboard, they're going to ask, what have we been doing with a keyboard? I interact in a natural way. And the same thing counts for clinical staff experience. We have been working with a German company called Bragi, who developed Dash. We connected that actually through the IoT platform to Watson, and we have built a prototype where the physician can actually ask, I'm going to see that patient X, Z. Can you look in the record and the medical record and list me all his diagnoses he had? And the system extracts these diagnoses in a hierarchical way or in a historical way. And then we connect it with knowledge. And I said, can you give me the last lab results, but only those relevant for his disease? So we do knowledge extraction, look into knowledge, what are the lab results based on his diagnosis that are relevant, and represent that. So we start experimenting with creating completely new way of interacting with machines and bringing that right information at the right time at the right place for these physicians. Then, very important, you probably all heard about the work we have been doing with Watson on cancer care. And this is, there's no volume here, so this is a demo, a video from the solution that we have built by Memorial Sloan Kettering. This is an oncology advisor that actually taps into all the knowledge that actually has been published in written text. It matches that knowledge with patient information. That patient information is extracted out of structured, non-structured information, And we only need a set of 85 features. That's the greatest thing, and we can handle 6 different of cancer with that. The system will then suggest, based on the literature that he has available, which therapy is actually the best fit for that patient. And it's not a deterministic system, it's a probabilistic system. And then you see that the system here says, like, you have to start with chemo, then you do surgery, then endocrine therapy, and then you do radiation therapy. But then he has many other suggestions with therapy would fit as well. This is not a black box. If the physician wants to see why that system took such a decision, then he can click on that system and finds exactly that study where that was published, why that system actually decided that this is the best therapy for the patient. Funny-wise, we have been selling that system not in Europe, not in the US. We have developed it at Memorial Sloan Kettering, which is the #1 oncology institute in the US. But we have brought it to Thailand, we have brought it to China, and we have brought it to India, where there's no expertise. So we're going to have an impact of bringing medical knowledge into areas where there is no knowledge. Here we are fighting with doctors, and we call something called evidence-based medicine. Well, in Europe, I'm challenged with eminence-based medicine, because every physician has his different guidelines, and he doesn't want to use a standardized system. So there's a lot of challenges by implementing such systems. And then this is a test that was published for the University of North Carolina. They tested the system on 1,000 cases. And for 99%, Watson said the same as the oncologist did. But in 30% of the cases, Watson found additional information that physicians didn't read or didn't have access to. Because medical knowledge is going to, in 2020, going to double in 72 days. And if then you look at the aviation industry, because we start to implement very scary technology, and there's a lot of fear around that they're going to lose their job, and what are we going to do with physicians? But if you look at the aviation industry, I've been digging into some data, then you see that in 1960, it took 6 pilots to do a transatlantic flight. Today, you use only 2. If you look at how much time during a flight do you think, does anybody know that? How much time of the flight does the plane fly automatically on a transatlantic flight? How much? Well, yeah, it's 92% of the time the computer is flying that plane. Huh? Definitely takeoff is completely manual, and landing is guided. And the interesting thing, if you look at the number of accidents that are happening by having these systems available, and the number of pilots that you need. So you have less pilots and you have less accidents. So I'm start making analogies to decision makers in the healthcare system, that if you use these systems, well, we're not going to have less doctors, because we can't afford to have more doctors, because we have a demographical issue in Europe and in the US and in Western countries. So we're going to have to do something different with the money that we have available. We need to do things differently. So this technology is coming very welcome. And then there is a big opportunity in Germany and other countries that what we did with Memorial Sloan Kettering, we can replicate that with anybody who wants to digitalize his knowledge. Every hospital that has 20 years of electronic health records sits on a lot of data that can be used for decision making. And there is a huge opportunity here for hospitals to start digitalizing their knowledge. Because if you are the first one that does that for a specific disease, and I was this week at a leukemia lab in Munich, and he's one of the best ones in leukemia diagnostics. And he says, like, in 10 years from now, I have everything robotized in my lab, but in 10 years from now, my knowledge is going to be digitized, and I'm going to be gone. So he's stepping into that, and he wants to develop with us a leukemia based on his data advisor for diagnostics. So there's a huge opportunity here.
Especially in medicine, we expect
that can be louder.
2020 that every 3 months the knowledge in medicine is going to double. So if we want to use this enormous improvement of medical knowledge, we need to have assistant systems, and we need to have software tools to get a hand on this. I must say we had started to use software tools on a lower level, obviously, before, and we used a lot of pay-for-service tools also. But the unique chance we see with Watson as a learning system is, especially in the field of rare diseases, where you have continuously to learn to get better. But this is an ideal combination for us.
So, this is the Dr. House of Germany. His name is Professor Schäfer. When we discovered him, he had questionnaires of 150 pages, which were algorithmic on paper, connected to each other. He has 6,800 cases that he can't analyze because everybody is sending their rare disease cases to him. Well, we started our project with the Rhön-Klinik, which is part of the University Hospital in Marburg. And Rhön announced with us that, okay, let's start digitalizing the knowledge and let's create an export industry out of that knowledge. We're not going to serve patients anymore only in Germany. We're going to create a product that is like a PayPal service for rare diseases. And if you think about the opportunity here, 70% of the world doesn't have access to healthcare services. If you start commoditizing that in a low price, what the potential is, just think of that. Back into the hospital itself, I truly believe, and this is an analogy on self-driving cars, that in 15 years from now, we're going to be able to create autonomous organizations where nurses will be guided by cognitive assistants. And we have our Watson Global Headquarters in Munich for IoT, and we are going to build an alliance on the cognitive hospital where we're going to bring partners, universities, data scientists together, and we are working with one hospital to really capture all that data and make that data available to build a hospital. That's the vision I have, and that's the thing what we want to do because I think it's necessary and I think it's really possible to do that, to build a very new way where people can work. I'm not going to go into the marketing. The platform that we use is the Watson platform where we have services. These are basic services. And you can do all kinds of things with that. You can use text-to-speech services in German and English in different languages. You can use chatbot services that are there. It's very easy to use. And the question will be, is if you have all the technology available, what is it what you're going to do in healthcare? And I really was pleased by the invitation because we need data scientists in healthcare, and we need people that start tapping in that data that we're going to make available in that hospital to optimize the hospital in a certain sense, and to create self-driving nurses, and create an environment where at the end nurses and physicians are happy to be at. Thank you for your attention.